internal structures of the heart. What do we find inside the heart? What do we have inside the heart? Well, you need to understand. For you to understand this, you need also to understand a bit about the embryology of the heart. Right. So, from the embryology of the heart, I'm just going to mention, we are going to do the embryology of the heart. But you need to understand that the heart, it originates from the splanchnic mesoderm, and it's going to develop as a heart shape. So it will not start like this. No. We are going to have a heart tube, right? This heart tube is the one that is going to give the shape of the heart through a process what we call cardiac looping. So you need to understand the embryology of the heart for you to understand what is inside the heart. Because there are certain remnants that are from the embryology of the heart that are seen here in the internal structure of the heart, which is very important. Right. So here, this is the anterior view of the heart. So we're going to find that we have structures that are leaving the heart. We have structures that are entering the heart. So the structures that are entering the heart, well, we have the superior vena cava here. This is the superior vena cava. We are going to have the inferior vena cava. The superior vena cava is going to drain blood from the head and the region that is above the diaphragm. Easy. So the superior vena cava, I'm just going to talk a little bit about the superior vena cava. The superior vena cava is formed by three veins. The first vein being the left brachiocephalic vein is going to join with the right brachiocephalic vein behind the costal cartilages, right, of the right, at the right aspect of the thorax. So they are going to join these two veins, and they're going to join like this one joining this one joining this. We're going to form the inferior vena cava, right? And then we are going to have another vein, the superior vena cava. That is going to form the superior vena cava. We're going to have another vein that is called the azygous vein. The azygous vein is going to drain at the posterior aspect of the superior vena cava. So the superior vena cava, this one, is informed by the left brachiocephalic vein, right brachiocephalic vein, azygous vein. So it's going to drain deoxygenated blood from the neck, from the head, neck, and the region of the thorax that is above the diaphragm. So that is the superior vena cava. We are also going to have the inferior vena cava that is going to bring blood from the lower limb and the abdomen. The inferior vena cava, from embryology, it's going to continue as the Wittlein vein, and other veins that are associated with the abdomen and the lower limb. Right. So the inferior vena cava, you need to check that the inferior vena cava is thicker than the superior vena cava. The inferior vena cava is thicker than the superior vena cava. Is it? Right. So we are going to have the superior vena cava draining blood into the heart, the inferior vena cava draining blood into the heart. We are also going to have four pulmonary veins two coming from each lung. So we're going to have the left pulmonary veins coming from the left lung, right two pulmonary veins coming from the right lung. They are also going to drain into the heart. So we have arteries that are leaving the heart. So as we can see here, this is our pulmonary artery trunk. Here, you can see here, the pulmonary trunk. And this is the aorta. This is the aorta. The aorta is divided into three. We have the ascending aorta. We have the arc of the aorta, like we said, that is bound in the superior mediastinum, and then it's going to continue at the lower body of the T4 as the descending aorta. But note that the arc of the aorta and the pulmonary trunk, they are all enclosed by the fibrous pericardium. So the part that you see, let's say maybe you are in a dissection room and then you have dissected the thorax. So then you see a structure, a red structure leaving the heart. So the structure that you see is the arc of the aorta, because the ascending aorta is covered by the pericardium. Right. So these are two, let me say, arteries that are living with the blood. That are living with the blood from what? From the heart. So now we want to, if we see here, we have an important structure that is called the ligamentum arteriosum. The ligamentum arteriosum is a remnant of what we call the ductus arteriosus. So during fetal circulation, well, I'm not going to talk about it in this lecture, but during fetal circulation, we have continuous communication between the pulmonary trunk and the base of the arc of the aorta. That continuous communication, that is called the ductus arteriosus. So after birth or the postnatal phase of life, you're going to find that the ductus arteriosus is going to undergo fibrosis. It's going to undergo fibrosis, where it's going to turn into the ligamentum arteriosum. So there are defects that are brought by if the ductus arteriosum fails to undergo that process of fibrosis. Yes. So it's very important. So here you can see this is the left recurrent laryngeal nerve. The left recurrent laryngeal nerve, it comes from the left vagus nerve. So as the left vagus nerve is the cause of the left vagus nerve, because it's associated with this ligamentum arteriosum. You need to understand this. So the left vagus nerve is going to give the left recurrent laryngeal nerve that is going to form a hook, sort of like surrounding a hook on the ligamentum arteriosum. So if we have defects, let's say that you have persistent ductus arteriosus, where the body failed to close, failed to close the ductus arteriosus. You're going to find during that surgery where we are going to separate the ductus arteriosus from the pulmonary artery and the arc of the aorta. You need to take note of this because you can damage the left recurrent laryngeal nerve, and that is going to affect phonation. Because the left recurrent laryngeal nerve, it innervates the larynx that is responsible for voice production. So this is about the structures that are living and entering the heart.